Our mission is to simplify and streamline access to services and supports, and to provide assistance to clients who are seeking services and making long-term decisions, or those in a housing crisis. So the mission is very general for a reason. We serve a lot of different people for a lot of different reasons. The specific populations that we're targeted to serve are people living with a disability of any age, people age 60 or older, regardless of disability status, also professionals and caregivers that assist those individuals, and also now we've added this other piece of any individual in a housing crisis. So obviously that could be any of those people above, or anyone can experience a housing crisis. So we've really kind of opened our doors to serve a lot of different people at this point. The services that we provide, basically people call on a multitude of things. So if I kind of go through all of those items, we'll be here for hours. So I wanted to really target the basics of what we do, and then some specific pieces that may assist people in housing issues. So the populations that we assist can range from eligibility screening and benefits counseling to assisting with applications, either in person or over the phone, and then following up to ensure those benefits were received. If we reach out during a follow-up and there have been barriers to accessing those services, we really try to step in and problem solve regarding the issues, and then advocate on behalf of the client to make sure that those services are received. We don't really want to refer individuals to places or complete an application and then not see it through. We want to make sure that those barriers weren't hit, because that can happen really quickly when you're trying to access benefits. Some of the services I've listed above on the slide in regards to health insurance benefits, food assistance, whether that be referring to food pantries or referring to SNAP or food stamp benefits, housing resources in terms of individuals who are just beginning in their housing search process or in the middle of the process and they need some resources to assist along the way. Like I said, along with many other services that aren't listed, it can be transportation, home mods, home repairs, really programs for children. It can be anything on any given day. That's kind of, it keeps it interesting around here. We do try to generally address the presenting need, of course, of the individual calling, but then as 211 said, we also assess for any ancillary needs that they may have. This is really important, especially during the cold winter months. We want to make sure they have their utilities on. Of course, we want to make sure they have health insurance and food in the household. I always give this example, and I stole it from my supervisor, which is someone calls us and they present that they can't afford their rent each month. They're always about $100 short. They're getting really behind. They're in threat of eviction. When we complete our assessment, we find maybe there's not a rental assistance agency that can provide rent ongoing, but we do realize that they have Medicare for their health insurance. Maybe they're low income. They meet the qualifications for a program through the state that pays their Medicare Part B premium, and coincidentally, it puts them a little bit of money back in their pocket, about $100 or so, and we address their presenting need of rental assistance with another program to allow them to remain housed and for landlords to keep that tenant, and kind of everybody wins at that point. So, it's really important for us to not only deal with the need that they're calling about, but also those other programs out there that they don't know about that we can get them enrolled in to get some money back in their pocket. We also provide some general resources to people, those easy ones like a phone number to a community resource. I need the number to aging, and we give it to them, and they're happy, and we're happy, and it's a very quick call. We don't get enough of those calls, but I'm definitely thankful when I get them. We also have one case manager on staff who does intensive case management for individuals 18 to 59 with disabilities working towards self-sufficiency, and that's through employment goals and education goals. So she has a pretty small caseload, so it's not kind of a general catch-all. It's very targeted and specific, but people can still access it by reaching out to the link. So I wanted to talk a little bit now about programs that specifically we refer to for individuals in housing situations. services for tenants, these two things that I had put on this slide I think really make sense in terms of we hear a lot of, we do get calls from landlords and where they complain about individuals who their units aren't clean or not up to the standards that they want. And we have, if there are individuals with disabilities or over the age of 60, they really could utilize some services maybe in the home that would allow them to remain in a home that's clean and able to be organized and sufficient for their needs. And those programs like homemaking services that provide light housekeeping and laundry, they come once per week or maybe twice a month. It's really done by assessment of each individual, but that they could really assist them with those needs to help the unit stay clean for themselves and for the landlord. It wouldn't hopefully not get to the point where it threatens their stay in that unit. So, and then there are some other programs known as waivers that are home and community-based services that those are a little more intensive. They are for a longer period of time, more frequently. It is a little bit longer of a process to get enrolled in those services, but they definitely can assist individuals to stay in the community and be in a home that is cared for if they don't have the ability to do it themselves. So those are just a couple of the programs that I thought were interesting for people who currently have housing, as well as the fact that we've taken on coordinated intake for the Allegheny County Continuum of Care for homeless programs. So we assist individuals who are street homeless with accessing homeless programs, as well as individuals who are street homeless and trying to find housing. So individuals who need rental assistance or also eviction prevention. So when landlords have a tenant that they're getting behind in their rent, they're going to have to give them some written notification or go to the magistrate. We are definitely a good resource to provide. We can talk through their situation, assess them for any resources out there to assist. For instance, eviction prevention programs like Urban League and ESG. We can do referrals to those programs. Again, for those programs, it means they have to have received written notification from a landlord or a magistrate. But if it even hasn't got to that point and there are tenants out there that could use just a brain to pick in terms of, what can I do to prevent this situation, they can reach out to the link as well to discuss that. Of course, if there comes a time when eviction can't be prevented, I would hope that landlords out there would refer individuals to us at that time to discuss any housing resource options we have, possibly talk about emergency shelters if that's to the point that it gets to where they're going to be asked to leave the unit. Landlords can reach out to us landlords can ask their clients or their tenants, reach out to us for assistance with some homeless referrals and to kind of talk through their next steps with housing. So something important to know is how to contact us. So we are open Monday through Friday, 8 a.m. to 7 p.m. You can also access information on the web. We do have a website, and individuals can email us as well for some information. We do accept walk-in appointments. They can walk in or make an appointment with us at 1 Smithfield Street, downtown Pittsburgh. And our phone number is listed there. It's not as catchy as 211, but it's 1-866-730-2368. Again, we can always provide information to anyone who calls, but if it's someone who needs to access services, so they need referrals to emergency shelters, or they need us to assist them with an application, they're going to need to contact us directly so that we can get those services to them. And one last thing, I just wanted to put some other resource guides on the slide. I always end with this, which is the Allegheny County DHS website has a lot of resource guides. So if landlords out there don't necessarily remember to call the link or remember the services provided, they can at least maybe get a resource guide to their tenant or use it for themselves or family members. So I wanted to put that information up as well. So that's the link.
Great. Thank you, Andrea. And next we have the folks from Crisis Resolve.
Good afternoon. This is Jim Weiler. Andrea, nice hearing you present since we're doing so much good work together these days.
Yes, we are.
So with me today I have Kay Rahuba and Alicia Allen, who have been supporting and leading the Resolve Crisis Network in Allegheny County for many years. So I will let, I believe, Alicia, you are going to open.
Good afternoon, everybody. And let me just ask Gail really quickly. Gail, how do I filter through the slides again?
Oh,
I got it.
Oh, okay. All right,
that's showing?
Good. Sure, yes. So I just want to thank everyone for being on the line with us here today at Resolve. And just to talk to you a little bit about Resolve Services, our purpose and mission is to be able to assist individuals in crisis, to resolve some of those crisis situations while still being able to create a very welcoming and person-centered recovery type of approach. We really like to meet consumers where they are and help them to maintain in their natural setting whenever that's possible. And as I will talk a little bit more in a few minutes about the various ways we do that, I will just put out there that Resolve Crisis is open 24 hours a day, 7 days a week. As you can see, 365 days a year. Some days it feels like 366 days. But we are always here. And the services that we provide are offered by bachelor's and master's level clinicians. We even have peer support available in our phone center as well as in our walk-in crisis center. And we do a plethora of different services. We offer phone counseling, crisis assessments, resources with the purpose of doing crisis stabilization and linkage. So, Jim, you can click to the next slide. As I was saying, we attempt to stabilize individuals. It is that moment in time. You're currently in a crisis and you don't know where to turn. You don't know where to call. And you yourself may not even be in crisis. This is a service that is provided where loved ones, providers, landlords, individuals in the community, there have even been neighbors that may call about someone else. So it's not just that consumers are calling for themselves, but other concerned parties are calling on behalf of someone. It's a voluntary service, which makes it difficult sometimes because if the person does not wish to engage with our service, we may have to take other means and another route in order to do the safety checks and provide some type of stability for them. However, it does continue to be a resource. So we are all about trying to assist the person in that moment and not be their treatment team or a long-term type of service, but how do we address the immediacy of what they're going through at that moment? We want to reduce stress. We want to help them problem solve and not do it for them. So our basic premise here is that the consumer defines their crisis. There is no checklist with Resolve in terms of you're in a crisis versus you are not. If a consumer comes to us and they want to work on everything from, we get those quick phone calls of I need a Pizza Hut number because I have 10 kids showing up here for a birthday party and I have no food for them, we either take that moment to provide them a Pizza Hut number in their area or educate that person a little bit about how you can go about finding that phone number in the future. The flip side of that is that we also have those very extreme cases where individuals are contemplating taking their own life or someone else's. And so you may get a phone call through our crisis line that says, I'm currently sitting here with a gun, and someone on this line needs to tell me 2 or 3 reasons why I shouldn't use it. So as you can imagine, those are at the very end of each spectrum, but everything in the middle is what we also attempt to address or handle or provide resource for. Any questions so far? Okay. And so our services that we provide come through a number of ways. We have a phone crisis line, and that number will be provided at the end of these slides. But through our phone crisis, individuals are able to, again, get resources, talk with a trained clinician, and an assessment will be performed on them in terms of lethality and making sure that they're okay and where we can get them linked to or provide other resources. If the person needs additional assistance outside of just that phone call, maybe people operate a little better with face-to-face communication, or they're just particularly struggling that day and could use some on-site assistance, we have the ability to send out mobile teams. Our mobile teams are clinicians as well as the phone center clinicians that are paired up in teams of 2 that go anywhere in Allegheny County. They can meet you at a home, a doctor's office, at your own apartment or a friend's home, and provide that very same service that you could have gotten over the phone. However, you needed additional support or a different type of support. So we still do linkage and referral out in the community, but we come to you. If outside of that mobile team you still need assistance, and probably the mobile teams would be the service that the landlords themselves may have the most contact with. We may be going out for a safety check on someone who lives in one of your facilities or residence, and we can't gain access. But due to the nature or safety concerns, we may at times have to get in contact with landlords and on-site property managers to try to gain access to individuals to make sure that they're in fact safe. If a person would need a little additional assistance even outside of mobile, we have the ability to provide walk-in crisis services. It's located at 333 North Braddock Avenue, here in Pittsburgh, PA, 15208. That walk-in service, again, each of our services has a component of the other, however, just in different settings and trying to really meet people where they are. Jim, you can flip.
Yeah.
I think I kind of covered a lot of this slide as well, just in terms of it not being long-term and very to the point and trying to address the immediacy and the urgency for what the consumer may be going through. And we, really try to focus on their problems and how much they're willing to do. We are not in the business of forcing anyone to do anything. For example, someone could come in and have drug and alcohol issues as well as housing issues, and the only thing they want to work on at that particular moment is the fact that they need shelter or that they would like to find an apartment. Many times we in the social service field, we know that if you would work on your drug and alcohol issues, it may assist you in obtaining housing. If that is not what they're willing to work on, we address that. We offer suggestions, but still meet them where they are and try to do the best that we can for the crisis that they wish to address at that time, in hopes that we're just opening up that door for them to know that when they're ready, they can still come back and receive an additional crisis service for other issues in their life. Jim, you want to keep flipping? So, and here's our information here in terms of how you reach our phone center clinicians. You dial 1-888-7-YOU-CAN, and that number is listed there. We answer calls every day, all day long, and you have you will get a live clinician on the line. When you call in, there may be times that you're put in a queue and waiting, but it is because our clinicians would be on other phone calls. We are always here, and we'll answer those calls in the order in which they were received. This is also the number that you would utilize if you were concerned and wanted to have a mobile team go out and do an assessment or provide additional support for someone. Jim and Kay, is there something you'd like to add?
Thanks, Alicia. Couple things I would like to add. Resolve, one of our main purposes in Allegheny County is that we work with all other agencies. So we are not in the business to take over. We're not in the business to step on anybody's toes. We're really about linkage and collaborating with what is the best scenario we can come up with to help stabilize the current crisis. A little bit of history. Resolve opened in July of 2008. We have been serving Allegheny County since then, and I'm very proud and happy to say that very recently we just passed the 1 million service mark. So we have provided over 1 million services to residents of Allegheny County since July of 2008. And as Alicia hinted at before, those services cover everything under the sun, from literally a true phone call asking for a phone number for a Pizza Hut, to those suicidal, homicidal callers on the phone, to working with the police, working with agencies, working with landlords, working with concerned others. We can do things like a wellness check on somebody, so you're just not really sure what's happening with your tenant. And so you would like somebody that can kind of touch base with that person and do an assessment to see if there's anything that we can provide that can help stabilize whatever you believe is happening. And I think that's it. So I guess, Gail, are we going to start taking questions now?
Yes, we are going to start taking questions. That was a bunch of great information. We have a question from Donnie Crawford. Would you like to ask your question?
Hello?
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 Donnie?
Yes. So I wrote my question in, so I'll just read it. I said, although some of these services are specifically tailored, for example, Allegheny Links focus on the elderly, individuals with disabilities, and those facing homelessness, there appears to be a lot of overlap. How does a person in need know which of these three services to call?
So I'll take a stab at that. We get calls like this all the time. So I know Ann talked a lot about 211. I think it's appropriate to, as a starting point, to either call 211 or to call Resolve. And, we'll do a little bit of conversation with you about what do you think is going on, and then we will direct, lead, link the best way we can. Sometimes when you call Resolve, it is just really doing a warm transfer. And by warm transfer, I mean we may get another agency like Allegheny Link or somebody, any other agency on the phone with you and kind of make that connection for you. And then we can back off the phone. Sometimes it's as simple as giving lists of resources to people for them to try. And, sometimes it is sending a team out or having a person come to 333 North Braddock so that we can sit down and talk more in depth about what you think you need and how we can best link you and direct you. So, Ann, I don't know if you have anything you want to add from the 211 perspective.
Thank you. I would agree with that. 211, I think with agencies, there can be overlap. 211's role is to be the first place that people call. It's an easy-to-remember number. People don't have to remember 10-digit numbers, and our role is to connect people to services, whether that be a warm transfer to a Resolve or providing information on link. What we say to agencies is that we can make it easier for them because they don't have to deal with the give me the number for this or what's going on with an area that's not in their core competence. So we are here to be that first call for people. Resolve, certainly we are not crisis experts, and we certainly have training and we'll stay with the person and make sure they are connected to Resolve. So that would be I would be in agreement with Resolve on this one.
Yeah, and I wanted to add as well. So although we do have focused populations, obviously individuals out there don't necessarily know that. So we do get a lot of calls of people who don't necessarily fit, our bulleted list of people that we help. But we definitely operate a no wrong door approach. So if someone reaches out to us and we don't have the services here that can help them, we will obviously, just the same as Resolve and 211, we'll get them to where they need to go. So you'll never hear a we can't help you or we don't do that here type of mentality. We definitely all want to make sure that the person gets where they need to go.
I think as well to that end is what's really nice in the past year for sure, and I'm sure prior to that, the network of providers within Allegheny County has become really well connected. And we do a lot of works with the county where we have opportunities to network together and share resources and ideas. So, probably it's a safe bet if you called any of the three presenters today, you're going to end up with getting on the path to where you need to be.
Excellent. Are there any other questions?
Actually, this is Alicia with Resolve, and the one piece that I did want to make sure that I cover, people usually ask about ability to pay or insurance, and I just wanted to make sure that the providers on the line were aware that if you have consumers that are concerned about getting involved with Resolve or any of our services, it does not cost them for us to come out to their home or for them to come into our walk-in crisis center. This is a county-provided services for residents of Allegheny County, and in extreme cases, even individuals that may end up in our county but are experiencing a crisis, and it is not based on individuals' ability to pay.
That's very good information. Is there any other questions out there? I have a couple of questions. My first question is for Anne. Now, with Resolve and Allegheny Link, these services tend to be geographically focused on Allegheny County. However, 211 is a much broader service area. For those who, may be working in the surrounding counties, would 211 be able to do the other surrounding counties have like eviction prevention programs and mobile outreach crisis services, and are you able to connect your callers to them?
Yes, we are. So 211 covers 11 counties in southwestern Pennsylvania. We also serve 5 counties in the Philadelphia area as well. I wasn't focusing on that because this call is related to Allegheny County and that general area, but we do actually serve 16 counties in Pennsylvania. We have services for every county in Pennsylvania available to us. Our area that we are responsible for are these 11 counties in southwestern Pennsylvania. So just as we need to know the services in Allegheny County and work with all of those agencies to know who's doing eviction prevention, who has food, who has a special holiday program, all of those things. We know that about the other counties as well. We have great relationships in those counties to make sure that the referrals are on target. And we welcome those calls. We also get calls from people outside in one geographic area concerned about a friend or loved one in another area, and we can field those calls as well.
From the Resolve end, I will just kind of piggyback on that. You know, into our phone center, people call from all over. In fact, at one point in time, we believe that our furthest phone call came from the country of Turkey into our crisis phone center. And while we may not be able to physically go out and see you if you're in another county, we certainly field those calls and we connect people via phone to either the county crisis line or a service agency in that county the best that we can. So we don't leave people hanging because they're calling in and they're from outside of Allegheny County.
Excellent, thank you. And then, does anybody have any questions? All right, I have a second question. This is for Andrea, talking about really the eviction prevention piece and those programs. And I was wondering, because that's something that can really, as you work with tenants, it's something that landlords, it would be good for them to understand. In my work with landlords, I've been hearing a lot that people let the tenant slide for 5 months even before they start the eviction process. Is the tenant able to access the rental assistance before the eviction process has started?
No, not necessarily. So yes and no, I guess. It's always a tough question, which is why people can be confused. So with programs for eviction prevention, they can be accessed so the landlords can write written notification of a pending eviction, or if this rent is not paid to current, I will be filing for the magistrate. If those notices go out to tenants, then we can make referrals to those eviction prevention agencies with the expectation of knowing that we make the referral to the agency. That agency then picks up the referral, and then there's a process. So as we know, everything is a process. And that can include an intake appointment. That could include budget counseling. But, you know, they've really been good about trying to make sure the landlords are aware of what's going on along the way. And if the programs don't do it, we always urge the tenants to keep landlords in the loop as to what's going on. You know, whether it's letting them know a referral has been made and these are the next steps. So so that it can be known that this isn't an instant thing when they get a referral from us, that those, you know, a check is cut, because that's not necessarily how it works. But hopefully allowing the landlords to have confidence in the process, and that at the end of this process, you know, everyone will come out winners. The landlord will get the back rent, and the tenant will be able to stay, and we've successfully helped someone. So it is a process, but yes, they don't need to go to the magistrate before accessing those services, but the tenants would need written notification that they're delinquent in their rent and that they need, you know, if they don't become current, that a magistrate hearing will be, you know, on the horizon. So at that point, we can hopefully intervene at that time and assist them to stay where they're at.
Great, thank you.
Mm-hmm.
And then my next question is for crisis or resolve crisis. And so my question is about sort of mobile outreach. I think one of the things that I have heard from landlords is concerns with tenants about, you know, nuisance properties, and we have an ordinance that if, you know, emergency services are sent out to homes repeatedly, that people then start to get citations, nuisance citations. Is a mobile outreach sort of safety check, does that count as one of those events that would?
No, these are, you know, a wellness check by, and Alicia, you can correct me or add to my comments, but wellness checks by Resolve are handled right between the caller and Resolve. and the person receiving the wellness check if they're even home. So we do not in turn get involved in that whole other system that you're referring to.
So we're not really considered emergency services. So a wellness check is that somebody is concerned about somebody. It could be for a variety of reasons. It could be that they haven't seen them for a few days. It could be that, you know, they seem really kind of down. They're not they're not their usual self. It could be that we get that from an agency because maybe they've missed a couple appointments and they just want to make sure that the person's okay. All of those are things that we do. That is not to say that there aren't times, depending on the call and the neighborhood and what we're hearing. We do sometimes have we have the police go with us, sometimes at the police request, sometimes because we may find out things like there's weapons in the home, there's different kinds of things there, or the context of the call would lead us that we would want police to go with us. But that is not our usual way of operating. It's two people in regular street clothes in a car that are just kind of knocking on your door. Most times the consumer knows that we're coming. So it would be like any other agency stopping in to just check in with somebody to make sure that they're okay.
Great, thank you. Are there any other questions from folks on the call? Well, thank you to everyone who got on the call today. We will be sending out all of this information to those of you on the call. And if there is not any other questions, thank you and have a great afternoon.
Thank you for participating.
Thank you, guys.
Thank you.